in DCF. And each estimate follows a pretty standard process. The first step is that Legislative Research, Division of Budget, meet with the agencies, and the agencies provide us with the most updated data that they have, population data for the different services included in the caseloads, as well as the most updated actuals for cost estimates. They also give us an explanation for any data outliers. So an example of that would be when there's some eligibility issues at KDHE and some members weren't being made eligible right away. That made some interesting changes to the data. So they explain that to us so we can take that into consideration as we're looking through the data and making our projections. They also give us, the agencies provide us with any assumptions that they made in creating their estimates. So that includes payments that were expected to be paid in one fiscal year that have been delayed, or changes in policies or program startups that have changed since the prior estimates. So after each agency gives us their projections, their estimates, and all of this data, we split up and we do independent reviews. So Division of Budget, KLRD, we review the expenditures separately. We're looking for, to make sure that the agency has included any policy changes that have occurred throughout the year. We look at their estimates for population growth and just generally see if we agree with that. We make any adjustments that we feel might be necessary. And we also look at line item changes. So we'll always look at the previous fiscal year and the previous estimate and see if there have been any significant changes between that and the agency's new estimate and make sure that any changes are accounted for. And then the last step is that we have a consensus meeting. So KLRD, Division of Budget, bring our estimates back to the group and we all have a discussion and we come to an agreement on a consensus estimate. Sorry, I'm forgetting about my slides. So the programs that are included in caseloads are limited to entitlement programs. So entitlement programs are those programs that are required by law to serve any individual who is eligible. So they can be identified as programs that are not allowed to have waiting lists. So in DCF, those entitlement programs that are included in the caseloads are temporary aid for needy families, the cash assistance portion, and then also foster care. In KDHE, it includes Medicaid or CanCare, and it excludes CHIP and MCHIP. The reason for that is that, well, Medicaid is a federal entitlement program. CHIP is an extension that this state has opted into, so it's not considered an entitlement program. So CHIP expenditures do not fall under this process. KDADS is a little more complex when it comes to caseloads. KDADS has two categories. The first one being CanCare, and this includes behavioral health services and nursing facilities. And then they have non-CanCare, which is made up of several programs: PACE, the medical portion, fee-for-service payments, and then also waiver and state hospital assessments. One important distinction to make with the waivers is that waivers themselves are not entitlement programs. However, being assessed for eligibility for a waiver or assessed for eligibility for admittance to a state hospital are considered entitlements. So those are included in caseloads. So for waivers, we separate out the medical portion versus the actual waiver portion, the costs for that. One of the most significant cost drivers of caseloads are the capitation payments. And capitation payments are the payments that are made to the managed care organizations that provide the Medicaid services. So these payments are based on the number of people that are estimated to be served by those MCOs, as well as the services that they're expected to need. So MCOs are paid a per member per month rate. And so that's a rate for each beneficiary. And that's for the defined packages of services that they are required to deliver under Medicaid. So the overall capitation rate is the rate for all of the individuals included in Medicaid. But because Medicaid has such a broad population included in it, we have what are determined or what are called rate cells. So the population of Medicaid is broken down into rate cells, and rate cells are created based on the anticipated interaction with the medical system of an individual, and it's largely based on how they're eligible for Medicaid. So there are approximately 34 different rate cells that make up the capitation rate. And some examples of these are the waivers, again, the Medicaid, the medical portion of the waivers. So that would be autism, the SED waiver, children that are eligible for their income level, children that are receiving long-term care, pregnant women, or medically needy. And each of these groups has its own rate. And then, as this graphic indicates, the overall capitation estimate is made up of the rate cell of each population, or the rate of each rate cell multiplied by the number of people in that rate cell. So these rates that are created for the MCOs are created between KDHE and their actuary and the MCOs. And they're regulated by federal statute. So there are federal statutes in place that ensure that these MCOs are being paid a rate that is sufficient to enlist enough providers, but also avoiding payment for any unnecessary utilization. It also specifies that capitation to risk-based managed care plans must be made on an actuarially sound basis. So KDHE does have actuaries that they work with to make sure that these rates are meeting all the requirements. So on the next slide, you'll see that the capitation, the population rate has gone up over time. So this is, this graph goes through 2020, and it shows the monthly average beneficiaries of Medicaid. What I would say is that it ends in 2020, but it starts to get a little bit interesting after that. So in 21, we would expect it to go up quite a bit, and that's because of the pandemic. And then we would expect it to level out in fiscal year 22. So along with the capitation rate, there are a few other cost drivers that are pretty significant in determining the caseload estimates. The first one being the federal medical assistance percentage, and that's generally known as the FMAP. Included in the testimony that you received for today's meeting, it should have been a memo that KLRD created on the FMAP. It goes into a little more depth than we probably need to go in today, but I wanted to make sure you had access to that. It provides some information on the past 5 years of the FMAP for Kansas, including the FMAP that is for CHIP, which is a little bit different than the overall FMAP. So the federal medical assistance percentage, or the FMAP, what it really is the federal match for Medicaid. So it determines the amount that the state pays versus the amount that the federal government pays for Medicaid services. It also includes adoption assistance and foster care. So the FMAP fluctuates each federal fiscal year, and it's unique for each state. So every time we do a new caseload estimate, we're dealing with a different FMAP for the next fiscal year. For a little bit of context, you can see on the slide that in state fiscal year 21, the FMAP was 64.2%. That means that the federal government paid 64.2% of the costs for Medicaid. And then in state fiscal year 2022, it goes back down to 60.04. And the reason for that is that with the public health emergency, the federal public health emergency that's ongoing, part of the benefit package that came with that included a 6.2% increase to the FMAP. This means that the federal government is paying 6.2% more than they typically would have in this year. And the enhanced FMAP is in place as long as the public health emergency continues. So in state fiscal year 21, for caseloads, we included that for 3/4 of fiscal year 21, and that created an SGF savings of roughly 160 million, although that number is ever changing as we're getting more and more updated actuals. Other changes in federal policy also act as significant cost drivers in caseloads. An example of that impacted this most recent caseload estimate is the Disproportionate Share Hospital, or DSH. They had reductions to that program so that the allotment for Kansas went down in federal year for half of 21 and all of 22. So that impacted the estimates, as did a repeal of the health insurer provider fee. There are also changes in state policy that often impact caseloads. Examples of that would be provider assessments, such as the Healthcare Access Improvement Plan, or the nursing facility provider assessments that were in place. New programs such as One Care Kansas, or new drugs that are covered. There's some drugs, if they're extremely expensive, are covered outside of the capitation rates because they're used so rarely, but they cost so much money. And one example of that started to be funded under caseloads, and it's a drug for spinal muscular atrophy, which is a couple $1 million per dose, but generally only used by 2 children a year. So on the last slide, you'll see some of the historical costs of caseloads. You can see that both the all funds and the SGF are trending upward. And again, that's largely based on the fact that the capitation is going up as well. I am happy to answer any questions about caseloads. That is the end of my presentation, but I know it was a lot of information. So are there any questions about caseloads?
Any questions?
Mr. Chair.
Representative Ballard.
Thank you, Mr. Chairman. I was looking at the cost cells when you mentioned there's like 34 different ones. Do they overlap? You know, I was trying to remember. I think they do, but do they overlap?
Some of them do, yes. And one example, I think it's the long-term care rate cell. That includes both individuals that are on the physical disability waiver, as well as individuals that are in nursing homes. So it has 2 different populations under one rate cell. That's not the case for all of them, though.
Okay, and in the case for each year that, you know, the federal rate changes for FMAP, when it, like, for instance, what you mentioned for 21, 64.2, but in 22, it's going to go down to 60. So our portion, I mean, goes down accordingly too, right, in the process. But what happens if the caseloads go up and they go down?
So the FMAP, yes, as that changes, the state has to pay more or less. So the difference that I highlighted in my presentation is a little bit of an anomaly because it's the 6.2% increased the fiscal year 21 number. So it went down by 4 percentage points. That's very rare. Generally, it's closer to half of a percentage point. So there are times, because the FMAP is based on, I believe it's like the last 3 years of personal income or per capita income in the state, it doesn't always match what's happening currently in the state. So there are times where the state share will go up and population will go up or vice versa. And in general, it kind of evens out over time because the FMAP is, going up and down a little bit each year.
Thank you. Answered that question. I asked that. I mean, I knew part of the answer, but I wanted to make sure the rest of the people knew, but realized that we may pay more one year, but then by going the other way, it would balance it out. But if you're short on money, it is really kind of worrisome, in the process. Okay. Thank you, Mr. Chairman.
Representative Concanon.
Thank you, Mr. Chair. Megan, on the graph that shows the capitation population over time, it looks like we are trending down on that since 2017. And I guess if I wanted to guess what that was from, I would say the limitations that we put on TANF. But am I wrong? Is there something else that's causing that? And if so, what are we doing right?
Well, those are just Medicaid beneficiaries. So
Okay.
I could be wrong, but I don't think TANF would influence that other than a very small portion. My guess is that it's tied to just economic factors. So because it's in general, most beneficiaries on Medicaid are income-based, then if there are fewer people that are falling into the income bracket that's eligible, then you're going to see the population rate go down.
So, okay, it's just a trend that's with the economy.
That would be my guess, yeah.
All right, thank you.
Any other questions? I don't see any other hands raised. I have a couple. Megan, I see the FMAP in 2022 is going to 60%. So it's going to stay up higher than it was when we started this. We got 6.2, so it was 57 something. So it's going to stay at 60 throughout 2022.
Right. So the base FMAP for, sorry, I'm looking up here because I have it on my desk. For fiscal year 21 was 59.7. So the FMAP, the state share actually went down a bit because the federal share went up a bit, the base rate. So it went from 59.7 to 60.4 from fiscal year 21 to 22. But fiscal year 21 was higher because of that 6.2% enhancement. Does that answer your question?
Yes, I was just thinking last year's figures when we were doing last year's budget, it was like 57 something that then because you add the 6% on top of it and you get to 64. So yeah, it is going up. In 15 and 16, our FMAC was going down because of the calculations, which if anybody's interested in, the way we calculate FMAP is interesting. It's interesting is all I'll say. And I used to have that number, but what I realize is we send the facts to the feds and they figure the FMAP. We do not have to figure that. So just don't worry. Okay, no more questions? Very good. Well, who's up next? Matt or Chardonnay?
Well, actually, I'm up next again.
Okay.
I'm going to quickly go over the budget analysis document and then some KDHE specific information. And then Sharday and Matt will do their respective agencies. So I'm, again, going to share my screen. Sorry, one second. Okay. Okay. So many of you are very familiar with the budget analysis document. It's likely new to a lot of you. So I just wanted to take a little time to go over the general document. You should have received a copy of last year's budget analysis for KDHE with the testimony. The budget analysis document is fantastic in that it has the information, any information you could possibly want about every budget. It's not fantastic in that it can be fairly difficult to navigate. So I'm just going to walk through some of the main components of it. So when you do get the budget for this for this current fiscal year, you'll have a little more understanding of it. So you can see on my shared screen, on the very first page of the budget analysis, there's this first table. This is kind of the budget analysis in a nutshell. So you'll see on the left column there, it divides out the agency information, funding information by fund. So you'll see the state general fund. So that gives you the information of everything that that agency is spending from the state general fund. And then other funds. And other funds can include fee funds, federal funds, special revenue funds, any funds that are included in the agency that are not state general fund. And then at the very bottom, also highlighted in yellow, it lays out the full-time employee positions for the agency. And then the columns are the actuals for, well, actually, I'm sorry. This could be very confusing. So let me clarify. This is the budget analysis that we presented last year for KDHE. So the numbers that you'll see across the top when you get the new budget analysis here in a couple of weeks for the agencies, the numbers will have moved up a year. So these numbers, I would recommend that you just ignore the numbers in this and look at it more as just like the overall tables.
Megan, I think that includes the Medicaid expansion that was in the budget last year.
The governor recommendation in this one does include Medicaid expansion.
Exactly.
Right. So across the top, you'll see the actuals for the prior fiscal year. And then each budget cycle, the agency, they provide a revised estimate. So last year, the legislative approved an estimate or a budget for KDHE for fiscal year 21. So this year, they're going to provide a revised estimate for 21. And that's going to be anything that's changed since they last submitted their budget that they need to have changed in their budget. And then at the same time, the agency will also submit a request for the budget year. So when you get the updated BA, the budget year is fiscal year 22. So you can see in the column, there's a column for the agency estimate. So that's their updated estimate. And then the agency request. So that's their request for the budget year. And then alongside both of those are the governor's recommendations for both of those columns. So the governor looks at both of the agency estimate and the agency request and provides her recommendations. On the next page, if you're following along in the BA, it's page 270. You'll see major issues from prior years. And this is just an outline for the last 10 years. If any, it highlights any legislation that's occurred that has had a significant impact on the agency's budget. So for KDHE, there's a lot of legislation happening around them. So this goes on for several pages. So it goes all the way up until page 279. So on page 279, you'll see that there's a section that's called the budget summary and key points. And I just wanted to point out a few pieces of this that will help throughout the entire document. In general, each section of the document is organized in much the same way. So in this section called the budget summary, it provides an overall summary of the entire agency's budget. And you'll see that it outlines, again, the agency's updated or revised request. And what it does is it gives you the amount of SGF, the amount of all funds, and then it compares that to show how it's different from the amount that was approved by the 2019 legislature. Or so for this year, it'll be the 2020 legislature. And then in the second paragraph there, for that same fiscal year, you'll see the governor recommendations. And that again lays out the all funds recommended, this SGF recommended, and then it describes how that compares to the agency's revised estimate. And then for the budget year, you can see that again, it lays out the amount of all funds and the amount of SGF, and it describes how it compares to the agency's revised estimate. So there it's comparing the two fiscal years. And then again, the governor's recommendation is also laid out and it's compared to the agency's budget year request. So if you turn to the next page, there's a section called performance measures. Each of the agencies collects performance measures, and that's data on different measures that they choose to collect information on to show how they've been progressing, how their programs are progressing. So each of the budget analyses will have a section for performance measures, and generally these are only a very small number compared to what the agency actually provides, but these are based on what the governor has chosen to highlight as the agency's performance measures. And then if you move to the next page, on page 282, you'll see that there's a 10-year operating expenditures chart. So this lays out the both a graph and then a chart showing how the agency's funding has changed over the last 10 years. And then on the next page is a table that we call the summary of operating budget. This is obviously a very busy table, but it has a lot of information. On the left column, you can see that it lays out the expenditures of the agency by program. So in KDHE's case, it has 4 programs: administration, public health, healthcare, finance, and environment. So you can see how each of those, how this spending is distributed across different programs. Below that, you can see how throughout the entire agency, the expenditures are dispersed between the major objects of expenditure. So that's salary and wages, contractual services, and so on. And then the last row is financing. So it gives you information about what percentage of the agency's financing is coming from the state general fund, what percentage is coming from special revenue funds or federal funds, so on. Across the top, again, you see the agency's estimate, the agency's request for the budget year, and then the third column in the first box represents the dollar change. So you can see in last year's budget, salary or administration programs funding went up by $822,000 between the first year budget request and the budget year. And then on the box on the right side, you can see the governor's recommendations. And again, you can make a comparison between the fiscal years. On the next slide, or on the next page, you can see that the budget overview is laid out fiscal year 20 and fiscal year 21. And again, we're still looking at the entire agency at this point. So this is all the programs encompassed under KDHE. And in this section, the expenditures are broken down by salaries and wages, which includes salaries and wages, pretty self-explanatory. Contractual services, which are in KDHE's case, largely based on the contracts that they have for some of their eligibility systems or information systems for the Medicaid admin program. It also includes some federal grants, contract employees that could be funded through federal grants. Commodities is largely supplies. Capital outlay is largely equipment. In KDHE's case, that could be for the laboratory. That's one that we'll be seeing a lot in the upcoming budget. Aid to local units of government is largely funding that is given through KDHE to local units of government. So a good example of that is local health departments. And then the last category is other assistance. And this is where in the Medicaid or healthcare finance program, you'll see that shift in FMAP come into play because the other assistance category for KDHE is largely made up of the Medicaid assistance costs. Also included in this section for the entire agency are two charts called the supplementals and the enhancements. So when an agency, when they turn in their revised estimate, they provide information on any, generally supplementals are going to be new funding sources or new programs. So in the top box, it says supplementals. You can see that last year, KDHE asked for $150,000 for website redesign. And then if you move over to the next two columns that say governor's recommendation, you can follow that line over to see that the governor and her recommendation did not recommend that the agency be funded for that supplemental. On the other hand, if you move down a row, mosquito surveillance, the agency asked for $134,000. And if you follow it over to the governor's column, you can see that she recommended that the agency did get funding for that. If you move down to the bottom line, you'll see where human services caseload estimates come in. So in this case, KDHE created their budget based on the most recent caseload estimates. And so they submitted their budget in September. In October, we created new caseload estimates. And the governor took those into consideration when creating the budget. And in this case, she decided that she wanted to recommend that the full estimate be added to the budget. So what that meant was that it actually decreased caseload amounts by 37 million SGF and 84 million alt funds. So the supplemental table is for the current fiscal year, and then the enhancements are for the budget year. I'm going to skip over some pages, and I'm going to go to page 295, on which you can see a couple of charts that might be helpful in just conceptualizing the agency's budget. One is expenditures by program, and then the other is full-time positions by program. So you can see how those are distributed throughout the agency. And then on page 296, in KDHE's budget, they provide an agency request by bureau detail. So KDHE is broken down into bureaus, and this lays out the bureaus that are in public health, healthcare finance, and environment, as well as the administration program. So I'm going to stop sharing my screen now. I have a little information about the actual programs housed within KDHE, but I'm happy if you want, Mr. Chair, to answer questions about the actual document, if that would be helpful.
Committee, any questions? I just want to remind the committee that don't pay any attention to the numbers. It's the process, and those are all going to change because we'll have 2020 actuals where you saw 219, and we'll be doing the budget for, we're in halfway through 2021, so we're going to actually be doing the budget that will take effect in July. So the concept is the same, the numbers will be all different. Okay, Megan, go ahead. We don't have any questions that I see. Representative Concanon, you don't have a question, do you? Your hand is still raised.
All right. One thing that I believe I forgot to point out early on is that even though the environment portion of KDHE is included throughout the document, the environment portion of KDHE is actually heard within a different committee. So this committee will focus on the divisions of administration, public health, and healthcare finance. So the Department of Administration is actually the administrative department that oversees the entire agency. And it provides services such as legal support, communication, both internal and external for the agency, as well as personnel, staff recruitment, staff certification, any of the processes that would typically fall under administration. The Division of Public Health is divided into 6 different bureaus. And in general, their mission is to just promote and protect health and prevent disease. The first bureau is the Bureau of Disease Control and Prevention. They work to identify and prevent communicable diseases. The second bureau is Health Promotion. The Bureau of Health Promotion facilitates state and local partnerships, and they work to create prevention frameworks throughout the state. The Bureau of Family Health is largely made up of programs that support maternal and child health. Some of the programs that are encompassed in this bureau that you'll likely hear about throughout the session are child care licensing, newborn hearing and screening, infant toddler services or Tiny K, birth defects surveillance, and also the nutrition and WIC services. The Bureau of Community Health Systems is a bureau that provides a coordinated response to any public health or radiation emergency. So programs included under this bureau are the Health Facilities Program, the Radiation and Radon programs, the Trauma Program, and also the local health local health departments. The Bureau of Rural Health, as you might suspect, has statewide programs to prevent and educate or to educate and promote on dental disease prevention. And then the Bureau of Epidemiology and Public Health Informatics is one we've been hearing about quite a bit with the pandemic. They work to create and collect and analyze data about public health information. They also oversee the vital records acquisition and issuing. They respond to outbreaks of disease. They staff a 24-hour response hotline, and they also administer the state's Health Information Technology Coordinator Program. So that is a very high-level overview of the public health program. The Division of Healthcare Finance is the third program that's in the KDHE budget that's heard in this committee. The Division of Healthcare Finance is largely made up of Medicaid administration and Medicaid assistance. So the Medicaid administration program is responsible for the oversight of the MCO contracts under the KanCare program. They oversee administrative responsibilities for KanCare, like eligibility, operations, federal reporting, as well as the KEYS system. The KEYS system is the system that determines eligibility for Medicaid, as well as programs in several other agencies, including TANF, SNAP Nutrition, and the LEAP, the energy program in DCF. And then finally, the Medicaid assistance is largely the assistance, again, that comes from that's carried out through the MCOs to those who benefit from the Medicaid program. So are there any questions? I'm happy to take questions about the program overview.
Questions? Seeing none. Megan, that might be something that the committee you could send out to the committee, and that would be the Medicaid assistance that goes back through the 400,000. I mean, it's not for 400,000 people, but it does, in fact, show how many people we do have on Medicaid.
The beneficiary numbers?
Uh-huh.
Sure, I can send that.
Okay, moving on. No questions. Go ahead.
Okay, well, you've heard enough from me. I'm going to turn it over to Matt or Sade. I see Sade pop up, so I'll let her move forward with her budget.
Very good. Welcome.
Thank you, Mr. Chairman. My name is Sade Kane, and I am responsible for the Department for Children and Families budget this year. I did incorporate the budget analysis from last year in your packet as well, and I'll be using that today. The Department for Children and Families mission is to protect children, promote healthy families, and encourage personal responsibility. The department operates through 8 programs: administration, child support services, economic and employment services, rehabilitation services, prevention and protection services, developmental disabilities council, client service delivery, and transfer to other state agencies. Since you already heard about one of the major programs that they have, child support services, 2 weeks ago, today I will focus on the economic and employment services, rehabilitation services, and prevention and protection services. If you do want more information on child support services, that can be found on page 345. I'll also note that this budget analysis incorporates the executive reorganization order that the governor put in her fiscal year 2021 budget, and she will be proposing one for this year as well. So this budget analysis will look similar to the one you receive in a couple of weeks. And I'll move forward to page 347 to start talking about the economic and employment services. The Economic and Employment Services has the responsibility for a variety of economic and other assistance programs, including temporary assistance for needy families, cash assistance, and employment services, energy assistance, refugee assistance, food assistance, the Food Assistance Employment Program, child care, and federal food distribution programs. There is an overview of the subprograms on page 349, and I'll just touch on a few of them. The Temporary Assistance for Needy Families Cash Assistance Program is a part of the Human Services caseloads that Megan went over a little bit earlier. This subprogram provides cash assistance to very low-income families. Families with incomes less than 30% of the federal poverty level may be eligible, and adults are required to participate in the Employment Services Program of TANF or participate in other work activities. Cash assistance is limited to 24 months unless there are extenuating circumstances, and then it's extended to 36 months. On page 350, I already spoke a little bit about the TANF employment services, but a little bit more about that is that all recipients of TANF are required to work at least or participate in work readiness activities at least 30 hours a week. And the program offers 12 months of transitional services to families. The Low-Income Energy Assistance Program, that's in the middle of page 350, provides a one-time annual benefit through helping with energy bills to avoid the shutoff of utility services during the winter. And I will move forward to page 352 to discuss rehabilitation services. The Rehabilitation Services Program is responsible for seeking the comprehensive vocational rehabilitation services. And their subprograms are found on page 354. The Rehabilitation Services Independent Living subprogram develops and provides individuals with the inclusion of in all aspects of community life, including engagement and employment goals, as well as teaching independent living skills and advocating for inclusion of individuals with disabilities. And lastly, the Prevention and Protection Services overview begins at the bottom of page 354. That program has a mission to protect children, promote permanent nurturing families, and strengthen community partnerships to serve children. Some of the subprograms within this program are Protection Reporting Center, Child Protective Services, Family Services, and Foster Care. And there's more detail on these subprograms on page 357. Families First Prevention Services, which you can find at the bottom, provides prevention services to keep children and youth from entering foster care and out-of-home placement through evidence-based or emerging programs in mental health, substance abuse, parent skill building, and kinship navigation. Child Protective Services, which is a little bit further up on the page, is a subprogram that responds to reports alleging a child is in need of care. So social workers and local offices are responsible for determining if a child abuse report is valid and whether there is a need for further action. On page 358, the Reintegration and Foster Care Services is also incorporated in this program. And this subprogram has used private contract agencies since 1997, and services provided by the child welfare case management providers include case planning, placement service delivery, and collaboration with communities. And that's the basic overview of some of the major subprograms and programs that are in the Department for Children and Families, and I'd be happy to stand for questions at this time.
Committee, questions? Seeing none, go ahead. Are you done, Chardonnay?
Yes, I'm done. Thank you, Mr. Chair.
You're welcome. Thanks for being here. Okay, Matt, are you ready?
And good afternoon. Can everyone hear me all right? So I'll be covering the kind of the program overview of KDADS. If you'll notice, I would imagine where Sharday left off in her formal budget analysis, you will see probably the KDADS programs pick up. But for the purposes of my presentation, I'll be going off of KDADS's budget analysis from last year as well. And so if you have a paper copy, the program detail begins on 401 or on page 27 in the PDF. Now, I will note that while for the most part, KDAD's structure remained the same, there are a few differences that I'll highlight when we come to them. But overall, KDADS is made up of 6 programs, the first being the administrative program. And this program just provides the administrative functions for the agency. It's divided into the office of the secretary, which includes the HR and legal divisions, as well as a financial informational service commission, which handles the budget, accounting, IT, things like that. In terms of the actual programs that it administers, if you turn to page 406 or page 32 on the PDF, you'll see the first program is the Aging and Disability Community Services and Programs Commission. And what that commission is providing those sort of senior services as well as services for individuals with disabilities. Those include Older American Act services, Senior Care Act services, some oversight of the home and community-based waiver services, just administrative functions, but providing nutritional grants, and some of those services that you would have heard last week from Janice DeBoer are included within this program. Now, turning to page 411 or page 37 on the PDF, you'll see the next program is the Medicaid program. This includes expenditures for entitlement programs. So when Megan started off today discussing the caseload process, all of those expenditures will show up in this program. So you'll have, Medicaid reimbursements for mental health, for nursing facilities, for substance abuse, as well as expenditures for PACE, the assessments for waivers, as well as assessments for the state hospitals. Included also are the expenditures for the waiver services themselves. Those, because they are not considered entitlement programs, they have wait lists, are not included in caseloads, but they are all included within this Medicaid program. And the next program that we'll move to is the Behavioral Health Services Commission, which begins on page 417 or page 43 of the PDF. And that's where you'll see those sort of CMHC payments, payments for substance abuse grants, problem gambling, addiction services, any sort of mental health, substance abuse, and addiction treatment, those sort of programs you'll find in the Behavioral Health Services Commission. And then for the purposes of this year, I'll turn to 412 or 47 on the PDF. You'll see there was one program that's the Community Service Administration program. That's been folded into the Aging and Disability Services. That was oversight of the home and community-based services, but the agency has since combined those into one program, which I spoke about earlier. The agency's fifth program is on 423 or page 49 of the PDF. That's the Survey, Certification, and Credentialing Commission. And that's the program that oversees kind of the adult care homes, health occupations, ensuring that people are in compliance with rules and regulations set forth by the state. They provide field examinations to ensure that facilities are in compliance. And then the final program, which is not in this budget analysis because it was a program for this year, is the State Hospital Commission. And that is the commission that provides oversight of the state hospitals, Parsons, KNI, Larned, and Osawatomie. Any sort of oversight that KDADS has over those four hospitals falls under the State Hospitals Commission. I will note that the four state hospitals are considered their own agencies that do have their own budgets, and they will be heard separately outside of KDADS, but for the purpose of oversight, they do have the show up in the State Hospital Commission. And with that, I would stand for any questions.
Committee questions. Doesn't look like any. Matt, you're off the hook. Congratulations, committee. You just spent $8 billion.
Was it only 8, Mr. Chairman?
Well, I'm guessing, actually. I haven't seen the true numbers yet, but.
Yes, but it's a minimum, yes.
Within $1 billion or $2 billion, how's that? That'll cover it.
Sometimes not enough.
Yeah. Okay. Very good. Megan, was there anything else?
No, I think you've heard enough from me for one day.
Okay. Well, that's kind of an overview, and committee, just do not get caught up in all this. It'll come to you, and we'll work on it. And this is just to give you an overview, but it loses me in about 2 minutes, so just do not get too overwhelmed to that. Any further questions? Tomorrow, I believe we'll have an overview of the PACE program. Is that right, Francie? Yes. So we'll get to talk about the PACE program and the way it provides a better outcome for our folks and how it works tomorrow. So very good. Megan, Matt, and Chardonnay, I'm going to apologize in advance for all my questions and all the hard work that you're going to do over the next few weeks to get this budget going. And you've already been victims of my searches for information on this stuff. And for that, I apologize. But Megan knows she was here last year, so she knows how it is in the budget process. So the other two, thank you. Very good. Well, with that, we're adjourned. Thank you.